This video will show the insertion of the AO60 lens through a 2.2 millimeter incision as shown here with this 2.2 diamond keratome. This is with the new 2.2 inserter. We first fill the hub of the inserter with some viscoelastic and then along the hinge edges using some AmVisc Plus here. We're showing right leading haptic has the little hump on it. We're going to grasp through the center of the lens and lift it out of the lens bottle holder. And again in the same direction with the leading right hump forward towards the hub. We need to place the lens, and this is my assistant Sharon Day inserting the lens into the holder. And we're going to insert it under the edge of each hinge area. There's a little shelf on either side. But it's very important to get each of these little flexible feet under the little edge of the hinge. Sometimes pressing on the center of the lens with the back of the forceps can facilitate this. And you can also push down on the little edges as you close the inserter cartridge. Again, just make sure all those little edges are underneath. You don't want to catch them. You want the lens to flow through the injector cartridge smoothly. So it's worth taking a few more seconds. This is the first time we were working with the cartridge, but it gets faster with time. Okay, we close it, and then we're going to insert it into the injector system itself. And it has a little open notch in it that you insert the injector cartridge into. Slide it all the way up, it clicks in. And then slowly push the lens in to the injector end of the cartridge, and you'll see it push up very nicely. If you need to, you can backfill the tip of the injector with viscoelastic, but this is usually not necessary. Okay, this is a wound assist method. You bring the cartridge against the edge of the wound, hold the eye with the second instrument, and slowly inject until the blue injector comes to the edge of the wound and then stop. The idea is not to get the whole lens into the bag, because you're going to assist the rest of the lens into the bag with your lens positioner. We position the lens, and then I think it is very important to make sure you irrigate, aspirate the viscoelastic out of the eye. And I like to get under the lens. If you don't like to go under the lens, at least move it back and forth, because you don't want to trap viscoelastic under the lens, because this can cause anterior vault of the lens the next day.